So, good evening, everyone. As of now, the NEET PG 2024 result are been released, and congratulations to everyone. So, this video is about who all should think to pursue a career in ENT, and whether you should take MS, DNB, or diploma as your career option, and what are the pros and cons of ENT per se as a branch, and what are the future prospect. Starting from myself, I have done my diploma of a national board program from Ursula Horseman Hospital, and I'm with full responsibility, I can say I've been having a very good experience after taking ENT as a branch. So, whether you should consider MS, DNB, or diploma, first of all, I know everyone with good ranks will always consider MS from any state medical college, because there is a general perception that there is a good academics and everything and all. So it's your choice, you can take, but if you are in a city and you know that your government medical college is hell lot of toxicity and everything, there are hierarchies: SR3, SR2, SR1, then comes JR3, JR2, JR1. I know that the majority of JRs doesn't get good hands-on even after completion of 3 years GRship. And if you get, it is very good. You must take MS definitely, because there is a guarantee that 99% of residents will pass until and unless you do something notorious activity. So talking about DNB, it must be taken by choice and with full proper research of the institute, because nowadays the DNBs have arrived in government hospitals, where the positive thing is that there is no toxicity of medical college. There is minimal hierarchy. The consultants and you are the only one working there. If you have done your good research, you can definitely take DNB. Just the problem is that passing percentage of DNB is quite low. Not lowest, but one of the lowest. So talking about me, I have done my diploma, and my passing rate was just about 30% only. It's your choice, and definitely if you take DNB, you will have to read very much. I have been starting my solo majors since 6 months itself, thanks to our HOD sir. And in diploma, generally people consider that in diploma what hands-on they will get and what knowledge they have, but talking about myself, I've been getting great hands-on, and I'm sure a few more diplomas also out there having a great hands-on, and they are like me, running private practice just after completion, immediately after completion of their diplomas. Talking about myself, even after diploma, even before my completion of the diploma, I have been performing solo surgeries like head neck procedures like thyroidectomies, parotid, maxillofacial trauma, orbital floor repairs, and maxilla mandible. Except skull base, I've been performing everything, and except cancer. Except first 4 months, I've been operating major surgeries. I've done almost 350 surgeries, major solo surgeries within residency itself. You cannot blindly select any institute just for the sake of their name and everything. It doesn't matter. Ultimately, what matters is your hands-on, your working skills, and academics is. We think that MS have better academics, but I know many people might not agree with me, but DNB has definitely better academics, because your teacher might not teach you, that doesn't matter, but to pass DNB you need a better academics, at least more than an MS resident, at least. And even talking about diplomas of the national board, you need to learn and you need to read more than any MS candidates. So either ways, if your teachers teach you, don't teach you, doesn't matter. If you want to pass, you will have to gain more academic knowledge than MS resident. Few people might not agree, but it is the fact what I have experienced. If you are interested in surgical skills, only then you should enter ENT. It is not at all a mild branch. It is a very demanding branch. Talking about the spaces and talking about narrowness and all the difficulties in performing each and every surgeries of ENT, it is one of the most demanding. It is having very long learning curve. It is one of the most versatile branch in amongst all the specialties. And from starting from here, from basic mastoidectomies, tympanoplasties, lateral curvature surgeries like glomus tumors and acoustic neuromas, cochlear implants, then bone and hearing aids, and many more. And then coming to nose, from starting from basic septoplasties to functional endoscopic sinus surgeries for polyp and CS of rhinular repairs, then epistaxis management, emergency management, then coming to plastic surgeries like rhinoplasties and all, nasal bone fractures to throat, from tonsil to adenoids and everything, from basic to the vocal cord surgeries, vocal polyps, thyroplasties, and emergency procedures like tracheostomies. Talking about what all surgical procedures apart from basic ENT, it also carries very high load of patients for plastic surgeries, for facial plastic surgeries, neck surgeries, neck dissections, thyroid surgeries, parotid surgeries, sublingual gland removals, from stone removals. There are 3 salivary glands which comes in under ENT domain. Other main thing is maxillofacial trauma. There is a hell lot of trauma, and maxilla mandible fractures, leaf fold fractures, orbital floor repairs, orbit repairs, and skull base surgery, anterior skull base like pituitary removals, adenomas, craniofacial resections. If you don't have any passion about ENT, you should not enter, because it is a demanding branch. As an ENT surgeon, we should focus first of all on the basic ear and nose and throat surgeries, if of course, but we should not forget we have a hell lot of variety in it. We should not leave skull base, we should not leave plastic surgery, we should not leave cancer, nothing.